Welcome to AffordableACLS.com, Solo Provider Adult BLS. Section 1, Safety First, the foundation of effective BLS. We've all seen it in movies. A person collapses, and someone rushes to their side, immediately starting CPR. But in real life, the first step isn't chest compressions, it's ensuring safety. This is about protecting yourself, the rescuer, and the person in need. Before you intervene, take a moment to assess the scene. Are there any dangers? Live wires, falling debris, ongoing traffic? Remember, you can't help someone if you become a victim yourself. Once you've confirmed the environment is safe, you can approach the individual. Gently tap their shoulder and ask loudly, "Are you okay?" This simple act checks for responsiveness. If there's no response, it's time to call for help. In the medical field, we often say, time is muscle. Every second counts when someone's heart has stopped. Immediately call 911 or your local emergency number. Don't hesitate. Get professional medical help on the way as quickly as possible. Section 2. Assessing the situation. Is it cardiac arrest? After calling for help, you need to determine if the person is in cardiac arrest. Cardiac arrest is when the heart suddenly stops beating. This means blood is no longer being pumped to the brain and other vital organs. Time is of the essence. Check for breathing, look for chest movements, listen for breath sounds, and feel for air on your cheek. If there's no breathing, it's likely cardiac arrest. This is where the new order of life-saving comes in. CAB, compressions, airway, breathing. This sequence prioritizes what's most important, restoring blood circulation. Why is this change from the old ABC, airway, breathing, compressions, so crucial? Think of the heart as the engine of the body. If the engine isn't running, nothing else matters. Starting with compressions is like jump-starting that engine, getting blood flowing to the brain and other organs as quickly as possible. Section 3. CAB, the new order of life-saving. Compressions are the cornerstone of effective BLS. Place the heel of one hand on the center of the chest, on the lower half of the breastbone. Put your other hand on top of the first, interlacing your fingers. Keep your arms straight, shoulders directly over your hands, and use your body weight to push down hard and fast. Aim for a compression depth of at least 2 inches. Allow the chest to fully recoil after each compression. This recoil allows the heart to refill with blood before the next compression. Maintain a rate of 100 to 120 compressions per minute. You can keep track by compressing to the beat of the song Stayin' Alive. After 30 compressions, open the airway. Gently tilt the head back and lift the chin. This maneuver moves the tongue away from the back of the throat, opening the airway. Give 2 rescue breaths. Each breath should last about 1 second, and you should see the chest rise with each breath. Then go back to chest compressions. Continue this cycle of 30 compressions and 2 breaths until help arrives or the person shows signs of life. Section 4. Effective CPR, quality over quantity. It's not just about going through the motions. The quality of your CPR matters. Effective compressions are hard and fast, allowing full chest recoil. Avoid interruptions. Every pause in compressions reduces blood flow, compromising the effectiveness of CPR. Minimize these interruptions as much as possible. Remember, you're manually pumping blood to the brain and other vital organs. Fatigue is natural, but try to push through it. If someone else is present, switch roles every 2 minutes to maintain the quality of compressions. Don't be afraid to push hard. Ribs may break during CPR, but this is a small price to pay for potentially saving a life. Don't stop until medical professionals take over. You are the bridge between the moment of crisis and the arrival of help. Section 5. Conclusion, you can be the difference. Knowing how to perform solo provider adult BLS is a powerful skill. It empowers you to make a difference when it matters most. Remember the key steps. Safety first. Assess for responsiveness. Activate EMS. And perform high-quality CPR using the CAB sequence. Keep in mind, even if you don't have formal medical training, your actions can be the difference between life and death. Don't hesitate to act. You can be the one who helps someone in their most vulnerable moment. Complete your BLS course today on AffordableACLS.com.